So robotics in general is better to do surgery with because it's minimally invasive. It's a big buzzword we use, but it allows us to do surgery through small little cuts in the abdomen or elsewhere and not make a big cut. So we can go in and do very precise surgery with this technology. So often we're limited in what we can see. So when we cut someone, sometimes the vision is very poor because it's deep. The surgical site is very low and deep in the abdomen. So what this does is this allows us to put a camera inside, expand the whole area for the abdomen with certain gas, and then when we put the robotic system on the patient, we're able to do more precise surgery because we can use instruments that are not sort of human controlled. They're robotic instruments, and they have what we call wristed technology. So it allows us to move in superhuman ways. So you can actually move and stitch backwards, forward, and in various ways that you would not be able to do with a human hand. So what the robot does is it allows us to see better. It's a 3D stereoscopic field. So it's like a virtual reality almost, is the way I always tell my patients to think about it. And it's sort of like I'm sitting inside the body while I'm doing the surgery. So it magnifies everything. It allows everything to be very controlled, very finely. There's no issues with stitching in various quadrants. There's very difficult places sometimes that you need to get to, which were difficult in the open technique, which are made much easier with this. So, as anything, technology advances, and so the first robot that we had here at Miriam, we were the first in Rhode Island, actually, to have that, and it allowed us to do various things, prostate removal, and also some kidney removal. With the advancement of technology, we were limited a little bit by the other robot. This robot has more capabilities. We call it multi-quadrant surgery, which means we can go anywhere in the abdomen and do surgery. Before we were just sort of limited to the pelvis or deep down in the pelvis. Now we can go anywhere.